here's a loaded question for you, Dr. Kahl. Why does relapse happen in the first place? And what are the changes in the body that signal when and if treatment is likely going to fail?
Boy, we wish we understood why relapse happened in the first place. You know, as I mentioned, most of these treatments can get people into remission, which means that they can kill, the vast majority of the cancer cells, maybe 99.9% of them. But for some patients, there's just a few stubborn cells that remain behind. Maybe those cells are just sitting there, not growing at all, which follicular lymphoma cells can do. And when the cells are not trying to divide, not trying to grow, they're kind of protected from killing. They're just sitting there doing nothing. And so we think it's this property that how the cells kind of protect themselves. And so these rare cells that are just kind of sitting there quiescently, not growing, not dividing, these might be the cells then that just hang around for years and then contribute to that relapse, 5 years down the road. But I admit we don't fully understand why one patient will relapse 2 years after a treatment and the next patient is still in remission 10 years later. These are things that we don't fully understand. Every patient's lymphoma is a little different, I'm afraid. So two people with follicular lymphoma, they don't really have the same cancer. Cancer, they're sort of like snowflakes. No two are alike. And so they can have different mutations inside the cells that'll make the cancer behave a little differently from one patient to another. It might make it respond to treatment a little differently from one patient to another. And so what is true for one follicular lymphoma patient may not be true for another. And that's just the way cancer is, I'm afraid. Changes in the body that signal when treatment is likely to fail. I don't think there are really changes in the body. I think, if a patient has symptoms from their lymphoma and we start them on treatment, we expect their symptoms to go away. So if a patient's symptoms are not being relieved, that might be a clue that the treatment isn't working as well as we want it to. And then in some cases, the only way to figure out if a treatment is working is by scanning, so we'll have a before picture from a PET scan or a CAT scan, and then we'll take them through a few cycles of treatment, and then we'll get another scan to prove that, the treatment is working like we want it to work. And if it's not working like we want it to work, then we'll say, okay, this one isn't working for you. Let's go to what we think is the next best option for you.